So in January, the NHS published a plan for how it wants to shape services over the next 10 years across the whole country. We want to talk to people locally so that they can influence us and help us get the NHS fixed for the next 10 years, and so we can get more joined up care and make it work better for people in the local area. We've done a lot of talking with people over the last 3 years in trying to get our Healthier South East London programme off the ground and running. And that's helped us change some of the services in hospital and the community to try and improve the care for patients. But we know there's more that we can do. And so it's really important that although we might find some topics and questions to talk to you about, that's only half the debate, and we want to hear what you've got to say. And so really, come and talk to us and we'll listen to whatever you think is important. The NHS plan is very broad, and so we want to look at 6 key areas and get your views on those. For instance, we might ask, what should the NHS be doing in working with primary school children? Children, young people's mental health, a really big issue that many people are now much more switched on to. But how can we help, for instance, young people use social media better? Should we have training for all of those delivering primary care to enable children, young people to get the most out of that? What about access to services? What's the best way, and when is the best time for you to be able to get the services you need? Improving hospital appointments, where, for instance, there isn't an overnight stay. You might need a call from your doctor afterwards. When's the best time for that doctor to call you? Social isolation and charities. So the NHS needs to work with a number of different stakeholders in local communities, and we need to know what services should we prioritise. What about services working together better? So, for instance, should there be a big difference between health and social care budgets? How can we join up services provided by both health and social care to work better to deliver the care that people need? To find out more or to get involved, why don't you take a look at our engagement page on the Our Healthier South East London webpage. You can find out about what's going on in your borough and some of the events that we'll be running. You could also answer a short survey on the webpage. We'll also be getting out into communities in June and July, trying to get to places where people are already meeting to discuss a number of these issues. We're particularly keen to hear from people who are affected by the changes that might happen, but don't always get a chance to voice their opinions about the decisions taken.